How GLP-1 medications aid weight loss. By Kirsten Hill Farmed, MPH, published on July 23, 2024. Medically reviewed by Mary Choi, Farmed. Indes Article. How they work. Ozempic. Wegovy. Mounjaro. Side effects. Considerations. Semaglutide GLP-1 medications for weight loss. APRAT/Getty Images. Ozempic, semaglutide, Wegovy, semaglutide, and Mounjaro, tirzepatide, are medications that can help lower blood sugar in people with diabetes or hyperglycemia, high blood sugar. All three medications belong to a class of drugs called glucagon-like peptide-1 receptor agonists, concisely known as GLP-1. While the U.S. Food and Drug Administration, FDA, has only approved Wegovy as a weight loss drug, other GLP-1s offer possible weight loss benefits. 231. How do GLP-1s contribute to weight loss? In your body, the GLP-1 hormone helps release insulin, a hormone that helps move glucose, sugar, from the blood into other areas of the body, where it can be used for energy. GLP-1 also helps to regulate the amount of glucose the liver makes by decreasing glucagon, a hormone your pancreas makes. 452. In people who are overweight or obese, the amount of GLP-1 hormone in the body is lower than usual. 5. Therefore, providing the body with more GLP-1 may help you lose excess weight if necessary. GLP-1 agonist medications are thought to help with weight loss in the following ways. Increase the amount of natural insulin available in the body, helping to move sugar from the blood. Slow the movement of food content through the stomach, causing you to feel fuller longer. Tell your brain that you are full, which leads to a reduced appetite and consuming fewer calories. One study found that the average weight loss difference between people who received GLP-1s and those who received a placebo drug was 4% to 6.5% in people with type 2 diabetes and 6.1% to 17.4% in people without diabetes. 6. Another study involving people with type 2 diabetes and obesity found that 1/3 of people in the study lost over 5% of their starting body weight after 72 weeks on. While Ozempic, Mounjaro, and Wegovy are all GLP-1 agonists, Mounjaro is also considered a glucose-dependent insulinotropic polypeptide (GIP) agonist. The GIP hormones work similarly to the GLP-1 hormone, helping to regulate the amount of insulin in the body and making you feel fuller quicker. 4. Which of these medications is best for weight loss? Ozempic and weight loss. Ozempic, semaglutide, is FDA approved to help control blood sugar levels in people with type 2 diabetes. This medication can also help lower the risk of cardiovascular events like stroke or heart attack in people with type 2 diabetes and heart disease. 2. Ozempic is a once-a-week injection that starts at 0.25 mg Menj and can be further increased by 0.5 mg every 4 weeks until you reach 2 mg, doses 7. Ozempic is not FDA approved for weight loss, though it may be prescribed by a healthcare provider off-label to help with weight loss. Off-label use means a medication is prescribed for a purpose other than what it is FDA approved for, which is common in healthcare aid. Ozempic contains the active ingredient semaglutide. Many researchers have utilized the 2.4 mg dosing of semaglutide for maximum weight loss benefits. However, the maximum recommended dose for Ozempic is 2 mg. Though this may be lower than the doses often studied, it is believed that Ozempic would still aid in weight management at 2 mg. Wegovy and weight loss. Wegovy, semaglutide, is FDA approved to lower the risk of cardiovascular events like stroke or heart attack in people with obesity and underlying heart disease. Wegovy is also FDA approved to help with weight loss in adults and children over 12 years old who are living with obesity too. The recommended starting dosage for Wegovy is 0.25 mg once a week. The dose can be increased every 4 weeks until the maximum dosage of 2.4 mg is reached. 9. Numerous studies have found that Wegovy supports weight loss, specifically when given at a higher dose of 2.4 mg once a week. 4. These studies, called the STEP trials, found that Wegovy led to significantly more weight loss, 16% weight change, over 68 weeks, compared to people taking a placebo drug, 5.7% weight change. 10. Over 2 years, the average change in weight loss was 15.2% in those who received Wegovy versus 2.6% in people who received a placebo. 11. Mounjaro and weight loss. Mounjaro, tirzepatide, is FDA approved to lower blood sugar levels in people with type 2 diabetes. Unlike Ozempic and Wegovy, Mounjaro works as both a GLP-1 and GIP agonist for, though not FDA approved for weight loss. Mounjaro has been shown to help with weight loss in people with obesity 12. The recommended starting dosage for Mounjaro is 2.5 milligrams once a week. After 4 weeks, the dose can be increased by 2.5 milligrams as needed. The maximum dosage is 15 milligrams once a week 13. Mounjaro has been studied in people with type 2 diabetes in a group of studies called the SURPASS Trials 4-1 study, SURPASS-2, specifically compared Mounjaro 5 milligrams, 10 milligrams, and 15 milligrams to low-dose semaglutide, 1 milligram, in people with type 2 diabetes 14. The following chart shows the average loss in body weight with Mounjaro after 40 weeks. Measurements are abbreviated as milligrams, pounds, ulbs, and kilograms, kgs. DOSAG average weight below 5 milligrams, 16.8 ulbs or 7.6 kgs. 10 milligrams, 20.5 ulbs or 9.3 kgs. 15 milligrams, 24.7 ulbs or 11.2 kilograms. Frias J.P. Davies M.J., Rosenstock G. et al. Tirzepatide versus semaglutide, once weekly in patients with type 2 diabetes. Engelchain Med. 2021 385-6. The 503-515. Doid:10.1056/NEGMO 2,107,519. When these dosages were compared to 1 milligram of semaglutide, people using semaglutide lost an average of 12.6 pounds, or 5.7 kilograms after 40 weeks. However, it's important to note that a 1 milligram dose of semaglutide is lower than the recommended 2.4 milligrams dose for weight loss 14. The average weight loss over 40 weeks in the SURPASS-5 study was slightly different from the findings in the SURPASS-2 study. Those on Mounjaro lost an average of 11.9 ulbs, 5.4 kgs, with a 5 milligrams dose, 16.5 ulbs, 7.5 kgs, with a 10 milligrams dose, and 19.4 ulbs, 8.8 kgs, with a 15 milligrams dose. People who took a placebo drug gained an average of 3.5 ulbs, 1.6 kgs, 15. Side effects. Before you start taking medications, it's important to be aware of any possible side effects. While taking GLP-1s, you may experience the following 41-22. Abdominal pain, constipation, diarrhea, heartburn,